We're going to jump into taking a look at religious liberty. It's my privilege to introduce, I got it here, Bill, hang on. My privilege to introduce a good friend, Bill Cox. Bill is the president and the CEO of the Alliance of Catholic Healthcare based in Sacramento, California. It's a statewide forum in which Catholic healthcare leaders collaborate to optimize their opportunities for ministry success in advocacy, leadership formation, ethics, and church relationships. There are 4 Catholic healthcare systems that belong to this. Those 4 systems are Dignity Health, now called Dignity Health, St. Joseph's, the Daughters of Charity, and Providence Little Company. And then there are other independent hospitals that participate in that. For 30 years, Bill's been the national and state level. He's been an innovator and he's been a leader in healthcare. And at the Alliance, he coordinated the efforts of these 5 systems to form the Ministry Leadership Center. And exciting program where they are training healthcare executives to appropriate the Catholic faith and the experience that they do in their leadership. And we've graduated 300 or 400 senior Catholic executives from that at the present moment. Bill's done so many different things. He's designed and helped lead the statewide campaign that delayed the implementation of the inexpensive earthquake mandate that was put in. He enabled the Catholic healthcare systems to adopt a statewide model policy on hospital billing that deals with low-income patients and the poor. He enabled the Catholic systems to develop a model policy on statewide healthcare reform. He helped defeat legislation that would have imposed onerous requirements for accessing the tax-exempt bond market. And most importantly, when Bill and I first arrived in California, we were able to team up to defeat the bill that would have required all of our Catholic healthcare people as part of their contracting for Medicus to provide abortions. And it was a wonderful partnership with the Catholic healthcare group, and Bill's been a stellar leader in that. He's written extensively. He came as the executive vice president of the Catholic Health Association nationally, where he led all of the public policy efforts that were going on there. He's been a leader in the social accountability budget kind of approach that we use in Catholic healthcare right now. And Bill's on the board of directors of the Alliance for Advancing Not-for-Profit Healthcare. He's the vice chair of the Ministry Leadership Center. He's the executive committee and the chair of the Providence Hospital Washington Board in D.C. He's and a member of our own California Catholic Conference, Religious Freedom. But most importantly, as a father and as a husband and as a friend, I introduce Bill. Bill, please.
Thank you very much, Ned, and it's a privilege to be here this morning to address a very, very important topic to the future life of the Church in the United States. My presentation this morning is,
The one that points down advances it.
oh, okay, thank you, Richard. I want to address 4 points. The first is that we live in a morally pluralistic society today. As Ned said, this is a very blue state. It's a dark blue state. And it epitomizes very much so the condition of moral pluralism in which the church exists today. And that creates special problems for it. I want to say a few words about that. I want to talk briefly about the governmental challenges to religious freedom and conscience rights. They're multiplying in the context of moral pluralism. They're becoming more difficult for us to address in this context. The third, I'd like to mention that nevertheless, we have to find a way in our society, if we want social accord in this society, if we want to be able to get together to figure out what the principles are going forward that will respect religious freedom and conscience rights so that we can cooperate as a society. Right now, we're at one another's throats over these questions. And then finally, what can we do? And Richard is going to be, Richard Dorklinger, a colleague of many years of mine, and will get into all of these things in much greater detail in his presentation. Let me begin by just mentioning moral pluralism. What it means is a plurality of views, religious, spiritual, secular, about what the world is and means and what the nature of the good is. We live in an environment where there are conflicting and different points of view on all of these questions. And in addition to the religious, spiritual, and secular views, I'd also say there's a large area of indifference. It doesn't matter. It just doesn't matter. I'm not going to get involved. I don't care. I think that's the environment, very much so, that we live in a place like California, but it's going to be reflected in parts of the northeastern United States, in New York, and in a few other states as well. And it's a growing development in our society, this notion of moral pluralism. It's certainly not the society that I grew up in and began my professional career in, when at that time you could simply call the archbishop of a major city, for instance, and say, we need to achieve this objective in the state legislature. Could you call the Speaker of the House or the President of the Senate and ask him or her, usually a him in those days, to help us get this fixed? And it was done immediately. That day is long gone, especially in a place like California or New York. It doesn't exist anymore. Today, the role of religious belief in public debate is hotly debated itself. Should it even have a presence? I recently read an article by a woman from the University of Wisconsin Law School who said, in our political culture, religion should have no presence in terms of the debate whatsoever. It's a form of what I call secular fundamentalism. That is, it excludes all other beliefs in terms of their relevance to public discussion. Related to that is the role of religious belief in the provision of healthcare and social services is also hotly debated. So in other words, if we want to continue to operate Catholic hospitals and provide healthcare services, we're going to have to provide all services that any particular patient may want or need. And in the area of social services, we have to provide all services or not provide any services. And we've seen recently where the church has been forced by political powers in a couple of states to give up its adoption services. Some of those adoption services have been operating for over 100 years, but because they wouldn't place children in same-sex marriages or with same-sex couples, political forces shut down those adoption services. How that helps anyone is beyond me. But unless they were willing to do it in these particular states, they weren't going to be able to continue to operate. It's very interesting to me that when we say that every provider in this environment, every provider has to provide every services, and in the healthcare arena that generally comes down to abortion. If you want to provide healthcare services, you have to provide abortion because that's what people want and need. It totally ignores the reality of diversity, that there are a lot of people in our society who would prefer a physician or a hospital that doesn't engage in these services. They're not given a role in this discussion, a voice in the debate, or even considered a part of it. Governmental challenges to conscience rights are multiplying. Here in the state of California, we have faced a situation where our own California Department of Managed Healthcare has, in its discussions with a couple of our healthcare systems that were updating and renewing their employer-provided health insurance plans, the department said, well, gee, you know, we think your plan is fine in every regard, except you don't make provision for for medically necessary abortions. You need to cover those if we're going to approve your plan before it becomes operative. We had to discuss with them and debate with them and engage in some difficult and challenging discussions to get them to recognize that we can't do that, and we can't cover those services. But it's pretty clear to me that the trend in terms of thinking in various state agencies related to health care is that more and more they're going to be perceiving abortion as the standard of care. Medically necessary abortions is the standard of care. And that if we're not willing to provide them, it may not be that we just don't get our health insurance plans approved, but that we don't get a license to operate a facility, or we don't get a license to become part of a new accountable care organization, especially if that accountable care organization has covered lives as part of its operation. In Kentucky, now just to show you that moral pluralism extends beyond the borders of this very blue state into a state that is, I guess people would say it's somewhat purple. It can go Republican or Democrat, but it is generally socially conservative, Kentucky. We had a major Catholic healthcare system indicate in the state that it wanted to develop a relationship with the University of Kentucky Hospital, or University of Louisville Hospital, which is a public facility that is having some difficult times staying open, maintaining quality care. And this large Catholic system said, we'll bring in, if we can merge with this institution, because we have other facilities in the area, and this would be beneficial to all of us, we'll provide $320 million in capital to the University of Louisville Medical Center of needed capital. We'll put in an additional $200 million for facility improvements, and we'll add $100 million in terms of our regional care for health care for the poor. Now, these are all things that the state of Kentucky, given its budget challenges, couldn't do. Not for the public hospital, not for the poor in the area. But the governor of Kentucky, first the attorney general, and then the governor said, well, we have problems with this potential merger, because we don't think that under the merger all services would be covered and provided by the University of Louisville Hospital, and by that he meant abortion. And finally it came down to over this one issue, and there were probably just a few abortions done at the University of Louisville Hospital, because abortions generally aren't done in hospitals unless they're very late-term abortions or part of a serious medical condition. He denied the merger. He gave up $320 million in capital for the hospital, $200 million in facility improvements, and $100 million in care for the poor in that region. All over, maybe 5-10 abortions a year. But it gives you a sense of the power of this issue, especially when it becomes political, and the kind of impact it can have even on our healthcare system. When people say, don't be a single issue voter, they're not talking about us. In Washington State, the state legislature has been debating and discussing and moving along a bill that would require all health insurance plans in the state to cover abortions. In the state of Washington, we operate a Catholic plan. It's primarily housed in Washington State and mostly covers lives in Oregon, but it would require Catholic health care insurance plans to also cover abortions, which creates particular difficulties for us. This bill has been stalled and kept from passage, but now they've gone into a special session of the Washington legislature, and the proponents of this legislation are trying to revise it. At the federal level, and Richard will get into a lot of this, the federal government has been very aggressive lately in this whole area of religious freedom and conscience rights. With respect to the Department of Health and Services Preventive Services Regulation, they included a definition of religious employer, which, as Ned said, was hatched here in California back in 1999, and it was included in the HHS rule. What that definition does is it basically tells a church, like the Catholic Church of the United States, that the government will tell it and define for it what is or is not a ministry of the church. Historically, that has been the role of people developing ministries in our church and the role of the local bishop to recognize those as ministries, not the role of the state. That definition of religious employer is a very large question for our church going forward in the United States. Right now, the definition is being used to require certain religious organizations, hospitals, universities, and social services, and others to cover contraceptives and abortifacients and sterilizations and counseling for those services in their health insurance plans. In the future, as the bishops have pointed out and noted, if this definition is allowed to stay in place, it will be used by other federal agencies inevitably to help define what is and is not a ministry of the church for certain public policies. And in the future, inevitably, it is going to be used to require these institutions to cover surgical abortions in their health insurance plans, if it isn't removed. So it becomes a huge priority for the church. In the area of migration and refugee services, which operates out of the United States Catholic Conference, am I correct, Richard, that it does? This past year, or for the past 6 years, Migration and Refugee Services has managed a contract for the federal government for services to the, oh goodness, Richard.
Victims of human trafficking.
Yeah, victims of human trafficking. It is a well-recognized program. They have done extraordinarily well in this program, but the grant came up for renewal this year. All of the career civil servants at HHS that had to review this said it should be renewed. An independent advisory board employed by the Department of Health and Human Services said it should be renewed, and political appointees intervened to say that the grant would not be renewed because Migration and Refugee Services does not provide referrals or provide abortions or referrals for them. So this 6-year contract, which everyone else recognized as being run very, very well by MRS, was not renewed. We're going to see, as I said, much more of this type of thing. We're also seeing in the area of conscience regulations that while we have existing laws on the books, especially at the federal level, but in many states as well, and Richard will go through some of the federal ones, these laws are not being enforced or they're not being followed. Here in California, when we said to the California Department of Managed Health Care, well, there's a federal statute called the Weldon Amendment that's in place that says that if a state agency or a local agency or any governmental agency says that an insurer or a healthcare provider has to cover abortions or provide them or refer for them, that they could lose their funding on annual funding under the Labor HHS appropriations bill. The California Department of Managed Health Care said, in our judgment, 2 things. One, it'll never be enforced by the current administration in Washington because the penalty is too large to be enforced. That is the loss of about $30 billion a year to the state of California. And they do have a point. It's hard to imagine an administration in Washington denying California $30 billion a year in federal funds for any reason. Second, they said we don't think it applies to us, that is the Weldon Amendment, because our agency doesn't directly receive federal funds. Well, that's a very cramped reading of the statute, but in any event, they didn't feel that they were covered by it. The Department of Health in Washington the HHS Office for Civil Rights is not enforcing Weldon. If it were enforcing Weldon, it would have enforced it against the members of the Department of Health and Human Services who intervened in the Migration and Refugee Services contract and said, we're not going to approve the contract because MRS doesn't provide or refer for abortions. Some conscience statutes at the federal level have no explicit penalty in them. And here's something we're going to be seeing more and more in this debate, in this context of moral pluralism that I've been talking about. We're going to see our opponents come forward and say, there are two provisions in the Constitution that are in conflict with one another. And it's up to the courts and the legislature to decide which one is going to prevail. Yes, there's a First Amendment freedom to free exercise of religion in our society. But there is also a 14th Amendment to the Constitution that we believe, and some court decisions have suggested, has a very broad right of privacy that protects issues related to reproductive rights. And we think the 14th Amendment right to privacy trumps, in many of these debates, the First Amendment right to the free exercise of religion. So this is going to be a whole new battleground that will be developing in this area. Now, I think if we just approach this from a common sense point of view, we would all say conscience is critical. We just came through a period in the United States, beginning in about 2008, 2007, where we had major financial institutions doing all sorts of things inconsistent with good ethical practice in finance that brought our country very close to being put into a depression. It put millions of people out of work, some of whom will never be employed again in their lives, because our society, our economy, when it recovers, simply will move beyond their particular skill sets. So we would say, absolutely, conscience is critical, and we want conscientious people in government. We want them in business and finance. We want them in law enforcement. We want them in the military. We want them in our families, and we want them in health care. Institutions have consciences. We run into the argument periodically, well, individuals have consciences, but institutions like Catholic hospitals can't possibly have a conscience. Yet we recognize them as persons in law. They make and abide by moral commitments. They make collective decisions of conscience. Society needs, and we want, conscientious institutions. But conscience cannot be legislated. It can be taught, it can be encouraged, it can become part of character formation. But you just can't pass a law and expect institutions to become conscientious. I think we can from time to time, but it's not possible. Regarding Catholic employers, I just want to make a point. We are different than other providers of health care, and I think we are different because of our mission. In California, we provide much more maternity care, more pediatric care, more coronary care. We have more neonatal intensive care units than other hospitals. And over 80% of Catholic hospitals in California have palliative care programs, which means we accompany and attend to suffering and dying people at the end of life. Over 80% compared to just 40-some% of regular not-for-profit hospitals. So if we begin to erase the Catholic footprint in healthcare in the state of California, we're going to see the service array, the services that are provided and available to people change as well, because the Catholic mission will be gone. Also nationally, in August 2010, Thomson Reuters, which is a completely independent consulting firm, found that in a survey that on 8 key measures, Catholic-owned systems are significantly more likely to provide higher quality performance, efficiency, and patient satisfaction than their nonprofit and investor-owned counterparts. We blew the competition away. And when I think about it, I say, well, what's different about us? I mean, we do tend to look, Catholic hospitals tend to look like many other hospitals. Where we differ is in terms of our mission. Where we differ is in terms of our intention and why we are in healthcare. And when you have, as in Catholic social teaching, one of your highest priorities being the dignity of the individual person, and that animates what you do as an institution, then you begin to perform on these measures in a higher way than other comparable institutions. The only other hospital systems that came close to Catholic hospitals with respect to meeting the same levels of performance were other religious hospitals, which very interesting. Now, Ignatius of Loyola said institutions are critical. They are certainly critical for the Catholic Church, because we cannot imagine ourselves as a church not reaching out to people who are poor and sick. We cannot imagine ourselves not reaching out to the uneducated and educating people, because following the role of Christ, our mission, one of our important missions, is to make sure that people have dignified lives through better health care, through better education, through better social services. It is integral to what we do as a church. And as Ignatius Loyola said, institutions are important because they are in a position to do good, cause good to spread. They have an impact on many people. The solutions they design can yield durable results, and they can greatly impact on the poor. Now, what can be done? I'm just going to briefly say a few things. One is, the first thing we need to do as a group, even though we're in this challenging environment of moral pluralism, is to repeal the definition of religious employer and enact an exemption from covering what we consider to be immoral drugs and procedures under the preventive services rule. That is not going to be something that will be easily done, because as soon as we attempt to do that, we are going to face an array of organizations who are well-funded, well-financed, and key government officials throughout the federal government who will strongly oppose our effort to do that. Do I think we can do it? I think we have a shot at doing it. I think we are going to have to mobilize our church in a way we've never mobilized it before in order to overcome the opposition. We need to strengthen existing federal conscience laws. Richard will mention how we're going to do that, how we would intend to do that. We need to develop much more effective messaging. We were really sailing along quite well when the issue about the definition of religious employer was religious freedom. And we saw the White House and our opponents quickly change the message to one of access to contraceptives. We have to get much more sophisticated about controlling our message as well. We will need effective judicial strategies going forward. We're going to be in court on these matters. That is inevitable. And quite frankly, I think we need thoughtful dialogue with responsible opponents. In this environment of moral pluralism, we could get a victory on a conscience rights piece of legislation or get rid of the definition of religious liberty tomorrow, and then have a changing legislative majority the following year that puts it all back in place. As a society, we need to begin to sit down with some of our opponents who are responsible, who are willing to dialogue with us, to determine what are the principles that we're going to adopt as a society that will enable us to engage in mutual cooperation and respect for conscience rights. And what are the means by which we will ensure that those principles will be actuated in our society. The Vatican has launched a program called Courtyard of the Gentiles, in which the Pontifical Council on Culture is engaging atheists and agnostics who are responsible philosophical leaders in Europe and elsewhere, to engage them on the question of the role of religion in society and its benefits to society. Because what I like about this program is the Vatican is very, very self-confident about Catholic teaching in this area. We think we can go head-to-head with the best on the other side of the question and make a point that's compelling enough for them to at least recognize the legitimacy of our position. I think we need to exhibit the same degree of confidence here in the United States and begin to engage some of our opponents. Right now, we're just going like this, and we're one legislative majority away from losing our rights. We need a more durable and lasting set of principles and mechanisms to ensure religious freedom going forward. Thank you very much.